Good morning, good afternoon, and good evening. On behalf of Dr. Tom Frieden, who unfortunately can't be here with us this morning, I want to welcome and thank you for joining us. We at Resolve to Save Lives are delighted today to release our latest Epidemics That Didn't Happen report and to discuss preparedness in action through public health success stories that you may have not heard about. Infectious diseases are an ongoing threat, whether that's the ongoing COVID pandemic, monkeypox, polio, cholera, or now again, Ebola in Uganda. In addition to managing these risks as well as new threats at hand, we must also invest in and prioritize epidemic preparedness. When we recognize outbreaks early and respond promptly and effectively, we can decrease the spread of diseases and save lives. Preparedness works, and every day around the world, public health doctors, nurses, and other expert staff are containing outbreaks and preventing epidemics. This is demonstrated in the new report published by the Prevent Epidemics team at Resolve to Save Lives. The second Epidemics That Didn't Happen report showcases 6 stories of epidemics that were stopped because of early detection, careful planning, and swift action. The examples include cholera, rabies, Ebola, and even the flu. Let's consider our case study of cholera outbreak in Burkina Faso, West Africa. Because the country developed a national cholera preparedness and response plan in June 2021, public health leaders were able to act quickly and effectively in response to confirmation that a truck driver had the disease. Rapid reporting, screening, and action by local health authorities in the community contained the outbreak to just 4 people, all treated successfully. Another really strong example took place in Tanzania, this time with rabies, which is nearly always fatal. Public health workers joined with community leaders to save lives by making sure that every exposed person received a vaccine. Without sensitive community engagement, more children would have died. When local efforts are supported by national and subnational government, we can stop and prevent epidemics. Epidemics that don't happen are inevitable, much less visible than those that do occur. And it's easy to focus on what's going wrong. But we can't let that overshadow the life-saving work being done every day by local and national public health workers around the world. We can learn just as much from our successes as from our failures. Taken together, these 6 case studies illustrate that early detection, immediate notification of appropriate authorities, rapid initiation of response measures are feasible. They also show the importance of the 717 metric, that every outbreak can be found within 7 days, reported in 1, and all control measures in place within 7. This is not just an ideal, it's achievable. These case studies demonstrate how well-coordinated action at the local level plays a pivotal role in stopping outbreaks, which are often first detected in the community. They reveal that public trust in government health organizations and coordination between government agencies are critical to both preparedness and response. Consistent investment in preparedness is necessary to support strong response to new as well as reoccurring disease threats. To guide our conversation on preparedness in action today, I'm delighted to share the virtual stage with our keynote speaker, Precious Matasu, former Director General of the South African Department of Health, as well as our esteemed speakers today, Marcio Garcia from the Rio de Janeiro Municipal Health Secretariat, Annie Hyundai, International Federation of the Red Cross and Red Crescent Society, Dr. Dalia Samore from WHO Regional Office in the Eastern Mediterranean, and I'm pleased to welcome our moderator, Erin Banaco from Politico. I will also be back to dive deeper into some of the other case studies later in the session today. Through outbreaks of infectious diseases such as COVID-19 and Ebola are inevitable, epidemics don't have to be. We have the tools to stop epidemics in their tracks, as shown in these case studies. Preparedness and swift action works. With that, I would like to invite Precious Matuso to the virtual stage. Precious is the former Director General of the Southern African National Department of Health. She was the World Health Organization's Director of Public Health Innovation and Intellectual Property. Precious has served on various advisory boards, both nationally and internationally, and was the chair of the WHO Executive Board. She was the co-chair of WHO Digital Health Advisory Group and was appointed as the member of the Independent Panel for Pandemic Preparedness and Response. Precious is currently the Director of Health and Regulatory Science Platform, a division of WIT's Health Consortium, and an honorary lecturer in the Department of Pharmacy and Pharmacology at the University of Witwatersrand. And it is the co-chair of the Intergovernmental Negotiation Body for the Development of Legal Instrument Convention or Treaty. With that, I would like to welcome Precious to the stage. Thank you.
Thank you. Good afternoon. Good morning. It is an honor to come and to present today, but also to be part of the release of this important report. The release of this report, Resolve to Save Lives, latest epidemics that didn't happen, is timely. The significance of this report is that it puts into sharp focus the importance of strong preparedness and public health systems. It also highlights the good efforts that have been made by countries. This report is important and timely because we can learn from these countries, but it's also because it covers 4 regions of the World Health Organization. And I would like to congratulate Resolve, but also those countries that participated in making this report possible. I am pleased because it is going to help us see the significance and value of public health and how we can make a strong case for additional investments, particularly for pandemic preparedness and response. But it also is going to help us galvanize support that will ensure that the public health preparedness is strengthened, especially at national and subnational level. So, what is it that is wrong? According to WHO emergency program, in the African region alone, there are more than 100 major public health emergencies that are reported annually, affecting millions of people. But we know that even though this is the case, on daily basis, public health officials are fighting hard to contain these outbreaks and prevent epidemics. So there are those who are making a huge difference with minor resources, even facing major constraints. So it is for this reason that we need to call for investment of resources in preparedness, investment for resources to build primary healthcare systems, but also we need to call on leadership and good governance and ensure that leadership and competence can be the pillar of our responses to these pandemics. So we do have best examples of decisive leadership, where we've seen governments working in partnership with communities, governments where leadership was taken and they made good investments. So there is a clear opportunity to build a future beyond the pandemic that draws on knowledge and wisdom from these countries where case studies are being shared with us. We can take the wisdom from these countries and the knowledge and use these at least to support other countries that have struggled to respond not only to COVID, but other epidemics and outbreaks that they are faced with on a daily basis. So the question is, why and how and where should we invest? One is that we must ensure that where we make investments, it must be in areas where we can aggressively create national and subnational structures so that they can be resilient and they can be able to respond. We must also invest in partnerships and ensure that there are collaborative arrangements at country level so that those partnerships are not just once-off, they can be sustained as well. We must also promote this principle of trust building. In some countries, we've seen that there's been a trust deficit, and without trust between communities and leaders and governments, we will not succeed. So, given what we all know, all countries should apply public health measures consistently and at the scale the epidemiological situation requires. So I would like to just leave you with a few points. Firstly, to say that well-coordinated action at local level, meaning sub-national level, not only national level initiatives, is important. It must be supported and there must be investments so that epidemics can be prevented. Secondly, the message I'd like to share with you is that early detection and response must happen locally with active primary health care and building resilience and trust in communities as essential building blocks for making communities better prepared, meaning we must invest in communities and empower them. Thirdly, communities must be better prepared. So these are practical country first and community first examples that are relevant and that must be considered so that we can be better prepared, not in our own individual countries, but even for the world to be prepared. This will ensure that even for the next one, we are prepared and we are ready. But one thing that I will not leave without mentioning is that as we negotiate, and me in that driving seat of those member states who will be negotiating with partners, the pandemic instrument, legal instrument, let it be driven by community first experiences. And these experiences that Resolve is sharing with us today. This will ensure that there's solidarity, but also equity that we did not experience. So let's take those corrective measures from these experiences and use them as lessons for the future. I thank you and congratulations, Resolve, for this seminal report. Thank you.
It's been a challenging few years for public health and the world as a whole. With Ebola in Uganda, the COVID-19 pandemic stretching into its third year, and many other outbreaks ongoing, including monkeypox, polio, and measles, it's sometimes hard to know where we're making progress. Too often, at the end of these crises, we really focus on what went wrong, how we could have done better, and we create long lists of things that we need to do to continue to improve. COVID-19's resulted in more than 300 recommendations at the global level. This is an important aspect if we are to prevent the next pandemic and continue to improve. But sometimes it's important to sit back and look at what's going right. How do we do more of that? How do we scale what is working and do it more often in more places and more consistently? That's why today I'm so excited to be here to launch our second Epidemics That Didn't Happen report. This is a key moment, first of all, to remember that public health has had some successes. Epidemics That Didn't Happen demonstrates that public health works. What this report does is help us show that everyday communities, local public health departments, national governments, civil society, who all work together to make sure that epidemics don't happen. These case studies are a great mix of examples of where early detection, quick response, Clear communication and coordination has led to the control of outbreaks before they occur. In this year's Epidemics That Didn't Happen, we feature Ebola in West Africa, Nympha in India, Cholera in Burkina Faso, rabies in Tanzania, and dengue in Indonesia. It's important to learn from and improve upon these successes. What were the keys to their success and how can that be replicated? Let's take a brief look at the examples of prevented epidemics. In the past decade, 2 Ebola epidemics have claimed more than 14,000 lives. The 2014-2016 West Africa epidemic primarily affected Guinea, Liberia, and Sierra Leone. In 2018, an epidemic wreaked havoc in the Democratic Republic of the Congo. Many lessons were learnt and applied, and we are seeing those investments pay off. In 2021, new outbreaks in both Guinea and DRC occurred under strange circumstances, with each country dealing with multiple other outbreaks, including the COVID-19 pandemic. But the outcomes were dramatically different. Guinea and DRC successfully controlled these outbreaks, limiting the spread and the mortality in both cases. And what changed? In each case, a whole-of-society effort to strengthen health systems followed these deadly epidemics, and it paid off. Each country made substantial improvements to its systems to contain disease threats and its engagement with communities to ensure that they were able to stop the threat before it spread. Nympha in India is another great example of learning the lessons from previous outbreaks. In 2018, a Nympha outbreak in India ended in 18 cases and 17 deaths, including a healthcare worker. Officials in the area hadn't faced an outbreak of this emerging disease before, but using the lessons learned and the review of what went wrong, gaps including surveillance capacity, data sharing, and healthcare worker supports were addressed and improved at the national and subnational level. So when an outbreak of Nympha happened in Kerala State in 2021, officials were ready. The outbreak began and ended with just a single case. Dengue in Indonesia is a fantastic example of how communities have control over preventing and controlling outbreaks. Dengue can be a challenge to control, but volunteers from the Red Cross in Indonesia use community-based surveillance to detect cases early. They found a resident in an agricultural village meeting the simple case definition of dengue. They were able to refer the person to healthcare. They were able to assess the community and the risk of mosquitoes and spread in the village, and they were able to take preventative action quickly, preventing the outbreak spreading to other households. Epidemics That Didn't Happen show that smart investments, improved health systems, and better coordination and communication by determined leaders can find, stop, and prevent outbreaks. I'm excited to continue our work in the upcoming year with our partners as we expand upon what we've learned from our colleagues in these case studies. Moving forward, we need to prioritize better protecting healthcare workers, improving the consistency in our response and detection efforts, and investing sustainably in preparedness. Teamwork across all levels of the response is critical. Thank you all for joining us in our celebration of these successes, and we look forward to partnering to prevent epidemics.
Hi, everyone. My name is Erin Banco, and I'm a global health correspondent with Politico. Thank you all for being here today for this really important conversation. I'd like now to introduce our panelists for today. First, we have Marcio Garcia, Health Surveillance Superintendent in Rio de Janeiro Municipal Health Secretariat. We also have Annie Handai, Senior Health Officer from the International Federation of the Red Cross. And lastly, we have Dr. Dalia Samori, Regional Manager of the Emergency Preparedness and International Health Regulations in the WHO Regional Office for the Eastern Mediterranean. I'd like to have each panelist give their 2-minute opening remarks. Marcio, we'll start with you.
Rio de Janeiro is a Brazilian municipality with 7 million people, one of the biggest cities in Brazil and one of the most visited cities in the world because of its natural beauty, culture, tourist sites that we have in Rio. At the end of 2021, with the reduction in COVID cases and the advance of the vaccination campaign, the cruise ship season came back to Brazil. And then on the 14th of December 2021, we got the information that a cruise ship would be arriving on the coast of Rio de Janeiro with 3,500 people on board, and that we had the suspicion of influenza cases on this ship. On the 17th of December, the ship crew, they notified the National Health Surveillance Agency, Anvisa here in Brazil, the health regulator, and then the following day, our team from the Municipal Surveillance Health Team.
Olá, desculpa.
I'm sorry.
Vocês me escutam?
You can hear me, yes?
Cristiano?
Yes, yes.
Sorry,
Oi, Marcos, eu te escuto sim, o pessoal te escuta, pode continuar.
Antes estava me escutando, não, né?
Sim, eu te escutava, eu estava traduzindo tudo aqui.
Ok. Então, voltando, no dia 17 de dezembro...
Going back on the 17th of December, the ship crew, they notified our National Health Surveillance Agency, Anvisa, about a possible outbreak of flu in the ship. And the day after, we mobilized the whole field epidemiologist team in Rio de Janeiro with all the lab support, and then we started epidemiological investigation. We did all the lab collection, the diagnosis through lab work, and also guidelines for control and prevention measures. As soon as we detected that a respiratory disease was afoot, we understand that detection, notifying, and timely response, that they were essential for containing the increase of influenza cases on that specific cruise ship. And then thanks to a municipal contingency plan for health events that we have in the municipality of Rio, and have had this plan since 2006. This plan has all flows, skills, charges of all the different players involved, and this ensures detection and timely response, once more showing the importance of having contingency plans, having a qualified surveillance network to detect health events, in a timely manner, and consequently answer, as adequate and appropriate. And for the start of our discussion, this is what I had to share with you for now.
Great, thanks so much. Let's now go to Annie Handayani, and let's have an opening remark from her. Annie?
Okay, thank you for this opportunity. So yeah, I'm very glad to be here as a representative of the International Federation of Red Cross. So yeah, we have our Community Epidemic and Pandemic Preparedness Program, or CP3, which is funded by the USAID. So we work together with the global health security partners in Indonesia on focusing on this community preparedness, and also build the capacity of the community to have this emergency response mechanism in place. So from this lesson learned from epidemic that didn't happen with the Indonesia case for dengue, so we learned that our community volunteer on the ground, they work closely with this local authority on how to use the community-based surveillance which is the focus on this community to empower the community voices to be to early detection and also conduct the early action before the epidemics happen actually. So now we're working closely with the government of Indonesia on how to sustain the initiative of community-based surveillance, because we learned after the 2 years of the implementation of the program that the accuracy of community-based surveillance, which is through the community case definition, which is reported by our community volunteers, which is more than 80% of the accuracy. So this is a very good example on how the community can be involved in the prevention and control for any kind of outbreak, epidemic, and pandemic at the community itself. So we learn from that we are now working together with the government on how to replicate this initiative national-wide for implementation in our country, in Indonesia, working together with the government agencies. So in terms of this community resilience for epidemic and pandemic, so we believe that epidemic start at community, and also the epidemic will end at community itself. So the community, in our perspective, being a subject on all this effort to prevent the epidemic in their environment. So now, through this initiative, we are going to promote the community voices, build the community trust, and also community engagement to be able to being prioritized on all this community resilience programming in Indonesia, on how to really ensure that the structure at community using the existing modalities at community can be prioritized, so it can be sustained, so it can be support the government, the local authorities, the local health authorities to being able to have this preparedness and also response mechanism for any kind of epidemic. I think that will be all for now, that I can share a lesson from Indonesia for dengue cases that the outbreak didn't happen in Indonesia. So back to you. Thank you.
Thanks, Annie. Thank you. All right, let's now move to Dr. Dalia Samori, an opening remark from Dr. Samori.
Thank you so much. Can you hear me?
Yes, we can hear you.
Very good. Thank you so much. And let me start by thanking you and the colleagues for being on this important webinar. And I also would like to congratulate Resolve for the important book that has been released recently. But of course, the countries that have been part of putting their success stories. And I think this is really important, the sharing of information, but also sharing the successes or great examples where other countries can learn from. As has been mentioned at the beginning, I work in the regional office for the Eastern Mediterranean, and this is a region where we have more than 50% of the countries are going through different type of emergencies. We also, during this year, have been witnessing more than 35 disease outbreaks. We're hosting more than half of the largest natural disasters, and the latest one was in Pakistan, which the flood, of course, which resulted in what have affected more than 30 million population. On the top of that, we are also hosting the largest humanitarian operations in 4 out of the 6 globally speaking countries, which unfortunately have resulted in a big number of people who are in need for humanitarian assistance. Having said all of that, this means that our response operations is going heavy on the ground, focusing on a number of countries, but also with other countries that are not going through big emergencies. They still face some disease outbreaks where the response is ongoing. But at the same time, this really puts a lot of efforts on our shoulders in order to work with the different countries to enhance their preparedness capacities. And for enhancing their preparedness capacities, I think we can speak endlessly about the areas of work that we need to focus on, or how we have been focusing on. And just taken from Precious, there are, of course, a big number of areas that can be mentioned in terms of governance, in terms of finance, and making sure that we have the right emergency management system, making sure that we are focusing on the communities at the center and having the public health functions. The list goes on and on and on. And I think we've been doing a lot of work. What I would really like to focus on here is cross-border collaboration, which is an area that we have been focusing on a lot in order to enhance the collaboration between neighboring countries, focusing on ground crossings and making sure that we are really able to put the needed measures in place where these countries can enhance their capacities to prevent the importation of different pathogens or sources of events that might become an emergency, etc. And the cross-border collaboration, it's really an interesting piece of work because it does cover the three administrative levels. At the national level, we want to make sure, and this is what we've been doing or working in countries with. At the national level, it's really the agreement. It's making sure that we have the right legislation or legal ground that facilitates having such agreements in place, but also facilitates their implementation as long as the agreement will be endorsed or approved. And when we talk about the subnational level, it's really the risk assessment to identify what is exactly the common threats that the neighboring countries need to focus on. What kind of capacities we have in place, and particularly at the ground crossings or the facilities around the neighboring countries. And of course, identifying the different programs that needs to be implemented, whether related to surveillance, sharing of information, joint risk assessment, joint response measures such as vaccinations, etc., or even quarantine or isolation. Really depends on the situation in each country. But also at the community level, part of the cross-border collaboration is looking at the communities around the ground crossings. And by identifying those communities and working with them to identify their capacities, but also to make sure that we are putting the needed measures in place to enhance or empower these communities has been something that we've been working on. One great example that I would like to share, but definitely can share more examples as we go on with this webinar, is the Iran-Iraq cross-border collaboration in the context of mass gathering, where Iraq is hosting a big mass gathering event. Usually it's a number of mass gathering events during the year, but one of the biggest usually takes place between September, October, and it hosts more than 20 million persons. And a lot of organizations is going on, but the cross-border collaboration, the fact that Iran usually send big number of pilgrims to be part of this religious mass gathering event in Iraq, this really necessitates a lot of work, not only for the mass gathering per se, but at the ground crossing where the people usually cross the borders between Iran and Iraq. So let me stop here, but just to let you know that this is an area that really worth a lot of investment, and we've been doing nice pieces of work, but also there has been some challenges that we were facing, but this is an area that we would like to move on with in a way that we really understand that it's an area that can prevent the importation of sources of events, and we can stop them at their source without being or becoming an emergency. Over to you.
Thank you so much for that. Really, the cross-border conversation is really important, and we'll come back to that later in this panel discussion. Given where we are in the COVID pandemic and that we're dealing with several health emergencies across the world, monkeypox in some cases, the U.S. has polio reemergence now. I think it's a really important time to dive into some of these pandemic preparedness conversations. So thank you again all for being here today. I'd like to start very broadly talking about where we are in terms of preparedness. The Resolve to Save Lives report brings up an important topic, how we can learn from our successes from the epidemics that we did stop. The report highlights several outbreaks that, thanks to health officials and workers on the ground, were stopped in their tracks. At the same time, I think it's important to acknowledge that 1 year, after the original report, which talked a little bit about monkeypox, countries across the globe are dealing with that outbreak. So we clearly have some ways to go. While there have been really important advances made in preparedness, it's clear, like I said, there's still some work to do. So let's dive in. I'd like to start with this question, and I'd like to start Annie, if she has a moment here. What is the most important thing that the world can do to prepare for the next pandemic? I know it's really difficult to narrow this down, but given time constraints that we have here today, if you could just pick one, that would be great. And maybe pull in some of your experiences working in Indonesia as well. What's the most important thing we can do to prepare for the next pandemic?
So the first thing is to creating the demand, understanding the needs of our country, of our nation in terms of the public health emergency in respective area, because somehow it becomes challenging, because if you're talking about disaster emergency, so no natural hazards or public health emergency will be sometimes somehow it being neglected. So as we learn from our program in Indonesia, so advocating this community-based surveillance through community epidemic and pandemic preparedness being a challenge to be a prioritized of our nation in Indonesia, because we're learning from COVID-19. So we have all this regulation, we have all this policy, but when this COVID-19 happened, so the massive communication within all the agency in Indonesia happen. So the first thing that we learn from COVID-19 in Indonesia, and also learn from our community epidemic and pandemic preparedness, is also the first is about the coordination. The solid coordination is not only on the paper coordination, but actually you have to know how to do this effective communication within the partners. And then the second one, bring all into the community level, cascading all these modalities into the subnational level up to the community level with the spirit of the decentralization, localization. So because we believe that the epidemic start at community and also will end at community. So invest the modalities of the preparedness and also response mechanism at community have to be a prioritization. Through the community-based surveillance, we empower the community to do the early detection and early action. So the community train on the community case definition and report immediately when the case happen. One cases happen, two cases happen, report immediately to the public health authorities or also the animal health authorities. And then it will get the feedback from the local health authorities to do the early action. So the coordination, effective communication, and also bring all these modalities to the community, roll out in this community-based surveillance for early detection, early action. That will be one of the key, some of the keys that we learn from the COVID-19. And I think that it can be also applied for other nations around the world to prevent the epidemic and pandemic prepare. Yeah, I think that will be all from my side right now.
All right. I think communication and coordination is obviously a huge part of this. I'd like to talk a little bit more about the ingredients to ensuring a successful outbreak response, and how we can replicate those lessons learned across the world in order to prepare for the future. When we talk about preparedness, we often hear the word strengthening health systems, which is a really broad term. And I'd like to dig into what that actually means for each of you and your own specific experiences. Marcio, can you draw on some examples from your own experience to describe for our audience what quote unquote strengthening a health system really means at the local level, and how that process can help with preparedness, drawing on your own experiences?
Então, acho que a gente pode
I think that
discutir fortalecimento
we can discuss the strengthening of health system. I would first point out readiness, because I think strong health systems need to be ready. It needs to be prepared, and this requires good planning. So it's important for us to have emergency plans, contingency plans, operational protocols, procedures, standard protocols and procedures. They need to be ready because emergencies just happen. They have no scheduled time, And then after you do all this planning part of work, we need to improve detection, particularly speaking. So we need to mix tools from traditional surveillance, which are usually passive surveillance, to active detection tools. We need to mix them up. And then we have surveillance based on digital detection of diseases. We need to have access to the data from electrical medical reports, as it were, so that we can put all of this together and ensure early detection of possible emergency situations. And then I see the strengthening of the system with the training, qualifying of our teams, be it the surveillance teams or the care teams, health care teams. And I'd point out that when we qualify the surveillance teams, we have the importance of the development of field epidemiology. In the city of Rio, for instance, since last year, we have been implementing the field epidemiology training course at the sort of basic level. So we have field epidemiologists for the front line. And at the moment, we have almost 100 field epidemiologists that have gone through this municipal education program, And then finally, communication. We need effective, objective communication. And all of this needs to have a coordinated response. And this is why it's important for us to set up emergency operations centers if we find ourselves in a situation where we have a public health emergency.
Thanks for that. I think the point you brought up about early detection is key. Dr. Samori, I'd like to go over to you to dig into more on the communication and coordination cross-border conversation that you had brought up in your opening remarks. Can you talk a little bit about how important speed is in getting that initial, information out to both officials in government and the public is to stopping an outbreak? And what some of the challenges have been in that cross-border conversation in the sharing of that information and the speed with which it's shared?
The most important thing is really to have arrangements in place or agreement, if you want. Because usually the agreement, when it's signed between two countries or more than two countries, to say 3 or 4, it depends on the type of collaboration that we have. It's supported by a legal ground, which means that its implementation should be pretty much easy, not easy as it sounds, but at least it would facilitate the implementation of this kind of agreement. And in the different type of collaborations across borders that we have at the moment, surveillance is the most important piece of work, because as we know that if we look back at the pandemic or even any other disease outbreak, early detection is the most important piece, I would say, initially, in order to be able to identify the problem. And then, of course, if you have the needed equipment in place that would facilitate the investigation and response, etc. But having the agreement not only identifies the areas of work, but also identifies the details. In other words, when we talk about early warning system or surveillance, the two countries or whatever number of countries they have the agreement, they really need to identify the number of events or the type of events that they would like to share information about. So in other words, it's not kind of an open agreement. It's really based on a risk assessment that identifies what are the common threats. And these common threats might be disease outbreaks, certain syndromes that would lead to disease outbreaks. It's part of the agreement. And once these common threats are identified, then the modality of information sharing also it's part of the agreement or the plan of action that usually follows this agreement. Now, it's very important to understand that when we talk about ground crossings or cross-border collaboration, it does involve so many different sectors. So it's not only the health sector, it's the health, it's the transportation, it's the customs, it's the military, it's the foreign affairs. And therefore, all the discussion that would lead to the agreement need to involve all the sectors, because everybody needs to bring their part of the agreement in order to make sure that when the agreement is in place, then its implementation is easy. So the cross-border collaboration heavily rely on the multi-sectoral coordination from both sides. And once we have the agreement, this necessitates having working groups between the two countries that would implement the agreement in terms of identifying the right modality for the surveillance, the information, how it's shared, whether it's timely, whether there is digital platforms that can be used, what kind of assessment that they need to do, whether it's joint risk assessment or its individual assessment, and then if they agree that there is a risk that is ongoing, then who should be taking part of the response, and who will be doing what part of the response, whether it's vaccination or other type of medical countermeasures, quarantine, providing of medical services, etc. What I'm trying to say here is that then the details of the agreement is really a lot, and everything has to be discussed and agreed upon between the two countries that are engaging in the cross-border collaboration. And not only that, bringing the different sectors on board is critical. And within each sector, you need to make sure that you're having the different type of people, high level for policy and the related discussion, but also those who are doing the operation on the ground. Because sometimes there are a lot of things going on the ground, and for someone who's sitting behind the desk might not really able to relate to these things. And therefore, having the different type of personnel involved in the discussion until we have the agreement in place and start with the implementation would be very important to make a successful agreement. I can give you the example of at the moment, for example, Pakistan and Afghanistan. As you might know, that we have the polio outbreak is still ongoing, but the amount of work is being done between the two countries, it's just marvelous. The agreement between the security sectors, making sure that they're able to check the vaccine certificates, providing the vaccine if people are not vaccinated. So the details of the agreement you won't be able to implement them until every specificity of it is being addressed and arranged or organized with the concerned party, means the different sector that will be related to it.
Thanks for that example. I'd like to, Marcio, go back to you to talk more about early detection, surveillance, since this is such a key part of what can prevent outbreaks or epidemics from becoming pandemics. I'd like to talk about the infrastructure that's needed to ensure surveillance is adequate and timely. Here in the US, for example, we are still struggling with our data systems to ensure that they are interconnected and that people can access really critical surveillance data at a moment's notice. Can you talk a little bit about your own experience and how important it is to have that kind of data infrastructure in place to ensure seamless communication?
Então, eu acho que esse é dos grandes desafios. Foi dos
I think that
maiores
this is one of
desafios
the biggest challenges.
no enfrentamento da pandemia.
It was one of the biggest challenges when facing the pandemic in Brazil was the production of information. Brazil has computer systems, national systems for some time now. However, these systems, they are independent. So I have a system for influence surveillance. I have a system for serious influenza cases. I have a laboratory sort of data system. So there's many systems, but they do not always talk to each other. So for me to produce a COVID epidemiological report in Brazil, it was necessary to have access to 10 different information systems. And this was one of the biggest challenges of our operations center for the fight on COVID. But we did learn something from the COVID experience. And now, this year, we have created an epidemiological intelligence center for the city of Rio. And one of the biggest goals of this center is to integrate all the information systems. So today we have a big epidemiological observatory in the city where we present the epidemiological situation of the main diseases and, public health threats. And now we are working on creating a data lake, in other words, a system which is going to integrate all health information systems. And this is our great investment, our great target for a near future, which is for us to have an integrated system where I can go in just one place and there I have all information, clinical information, epidemiological information, laboratory information, and then do surveillance using this integrated system. And if possible, which is another challenge, would be for us to start predictive models for us to be able to detect a possible emergency before it happens. So this is the path that we are going, that we're traveling down in the city of Rio de Janeiro.
Thanks for that. I'd like to turn now to a bit of a different conversation. So much of what we talk about in terms of preparation comes down to how each government or local government, for that matter, prepares. Preparedness is easier in some parts of the world than others. Annie, I'd like to direct this question towards you. What are your thoughts on the intersection of philanthropy and government in working toward greater preparedness? Can preparedness truly be adequate if some of these philanthropic endeavors lose funding, for example, year to year, or cease to exist in the next 5 to 10? Given your role, can you talk about coordination between NGOs and philanthropies and government in preparedness?
Yep, thank you for this question. This is a very interesting question, actually. So, under our program, Community Epidemic and Pandemic Preparedness, we have our third work stream, which is called Stakeholder and Private Sector Engagement for Epidemic and Pandemic Preparedness and also Response. So, in terms of this, how to gain this engagement with the private sectors, other stakeholders, a bit challenging actually for the sake of this implementation reality. But again, creating demand and also needs from this the back donors, and also creating the evidence to them, which is we can provide this documentation, a solid documentation on how we work, how it's success to prevent the epidemic and occur at the community itself. So learning from our experience and implementation. So bringing this, like for example, community-based surveillance with accuracy more than 80%. So we documented this as a policy brief to the government of Indonesia, and then we get a very good buy-in from them. And now we already have this national roadmap for community-based surveillance implementation for nationwide replication in Indonesia, which means that this program not only belongs to the Red Cross as the implementation, for the implementation, but again, the government of Indonesia already interest to support for the national-wide implementation. And through the government engagement, they also invite the another partners, NGO, the back donors to also contribute to this initiative to scale up the community-based surveillance as the modalities from the community for early detection, early response, which is very, very strategic part, how we can prevent the epidemic and pandemic. So now learning from this experience, creating demand to the government with the solid policy brief, good documentation and evidence, and it will also invite the government itself. They will also invite, because they have this authority in this nation, they invite other partners, they invite also the philanthropy, the back donor, USAID, DFAT, and other partners to also contribute to the nation of Indonesia, led by the government itself. So the key points is the creating demands, supporting with the solid documentation, and make it as simple as a policy brief, not only for the government, and also for other partners from the back donors, because the philanthropy right now, they want to see the real impact on your investment. So what next? What next after you train the community volunteers? So the impact, the immediate impact, has to be documented quite well, very well, so we can present our a good effort, a good result of our implementation as the evidence-based documentation for the scaling up for the broader area of the implementation. So this is how we work with this sustainability for the long-term project to the program transition. So I think that will be all for now. Share our experience working with this advocacy partnership with all these partners, including the government and other bodies, UN agencies in Indonesia, and also the philanthropy organization.
Thanks for that. This is for the audience. In just a few minutes, we'll be taking your questions. If you have a question for one of our panelists, you can submit it as a comment under this live stream on YouTube, as a tweet using the hashtag Epidemics, or you can comment directly on Resolve to Save Lives Facebook or LinkedIn event stream pages. I'd like to have a closing question now for Dr. Samori. I'd like to talk a little bit about diagnostics, vaccine, therapeutics. access to those medical countermeasures, how important it is. And let's talk a little bit about equity here. You're an individual that works across multiple, different countries. I'd love to hear your perspective on some of the challenges that have arisen either from COVID or other epidemics where countries, maybe some countries you're working with have greater access to those medical countermeasures than others, how you work cross borders with some of these challenges. Could you speak to that at all?
Sure. And this is really a very important question. And I think we can just take back or bring back the experience that we all have faced during the COVID pandemic, which is still ongoing. That some countries were able to get access to the vaccine as soon as possible, others were not. And even when it comes to quantities, when it comes to type of vaccines, but also when it comes to regulating the use of vaccines and, the supply chain and the cold chain that was needed at the country level to be able to store the vaccine and use it for the communities or population. I think there has been a great challenge when it comes to equity, and that was one of the main lessons that we have learned, that in order to be able to prepare and rapidly respond to any future health emergency, the availability of medical countermeasures, but also the equity in accessing them is very important. And this is exactly what the new treaty that has been decided to come through as a new instrument or legal instrument, if you want, that would address this part of equity in relation to medical countermeasures, particularly vaccines. The discussion for this treaty is still ongoing. There has been two informal sessions, one more to come, but the actual discussion or negotiation of the content of this treaty will start early next year. And we do hope that this treaty would be able to come with solutions of this main challenge. But just to highlight that this new treaty is coming on board to complement the international health regulations, which is absolutely a fundamental and a great piece of work, a legally binding instrument for member states, which is, of course, still to continue to be in place with a little bit of targeted amendments that also was decided. But the beauty of the IHR having it in place is that the obligations on member states to build their capacities for preparedness and response. Having said that, in order not to go through what we've been going through, I think the lack of the implementation or the insufficient implementation of these regulations have been a major issue and continue to be a major issue. And therefore, one of the areas that we are working with countries on to make sure that there is a system for emergency management. And this system, it's true that there has been bits and pieces of this system in most of the countries, maybe more comprehensive in some countries, but not in the other countries. But having this holistic approach or overarching emergency management system is very important. That looks into governance, looks into multi-sectoral coordination, makes sure that we have in place the public health capacities as refer to them in the international health regulations, but also we make sure that there is identified list of essential health services and access to those services for every single person inside the country. And on the top of that, we make sure that we have the needed resources, whether financial resources or the workforce that will be able to implement the different bits and pieces of this emergency management system. This is what we've been lacking. So there are parts to be done at the country level in order to be prepared for the next emergencies. Nobody can tell when, but this is something that we cannot neglect. But at the same time, and at the global level, WHO has been doing its part in addressing this equity-related issue, which came as one of the main recommendations in different reviews. And we certainly hope that the new treaty will address this part. It will go into negotiation because the component of this, or if you want the details in relation to it, will take a lot of discussion between member states in order to be able to finalize it. And after it's finalized, of course, it will go for endorsement or adoption at the country level. So this is, of course, what we've been facing, but there are certain solutions that we're trying to put, but we also do hope that a lot of work need to be done. And we are working with countries to guide what needs to be done by understanding the situation, but also the capacities and the structure. And therefore, our support is pretty much tailored and targeted. Over to you.
Thank you for that. So much going on with the IHR conversations. I'd like to throw just a small last question to Marcio. In talking about medical countermeasures, part of that is access to diagnostics, which of course is important for surveillance. Can you talk about what the challenges or successes have been in your country in accessing a regular flow of diagnostics? Are you concerned at all about the supply chain, I guess, not just for diagnostics, but other medical countermeasures in the future for future outbreaks? Can you speak to that at all?
Então, acho que a pandemia de Covid,
I think that the COVID pandemic brought important concerns, particularly for the big countries. Brazil is a huge country, the size of a continent, and each region in the country has an important characteristic. So we have more developed states in Brazil, and we have some states in Brazil that are not as developed, but we need to act as just the one country. It's a big challenge when facing the COVID pandemic, for instance, in Brazil, was the lab diagnostic, but there were some important advances, particularly in developing molecular biology techniques. Today, pretty much every Brazilian state is able to provide the diagnostics through molecular biology. But this is still a sort of knowledge gap. We still need to develop more. Particularly, we need to strengthen the sort of surveillance of respiratory viruses. For instance, in Rio, we have like a sentinel surveillance network, but it is important for us to increase even more the diagnostic sort of dashboard, as it were, of respiratory viruses. So this is a challenge that we're moving forward with, in partnership with the public health laboratory from the state of Rio de Janeiro, and particularly in partnership with the Osvaldo Cruz Foundation, which is a foundation in Brazil that works as a national center that works as a benchmark in lab diagnostics. So when we involve these partners, we believe that we are going to be able to increase, scale up these lab diagnostics for the main agents that could actually lead to public health emergencies, particularly respiratory viruses.
Thank you for that. I'd like to turn now to some audience questions. Dr. Samori, I'd like to direct this one toward you. This is a question via LinkedIn. How can we anticipate and react to infodemics during emergency response efforts? So misinformation, disinformation, how do we work around some of those challenges in the next pandemic?
Well, this is absolutely a great question. And I think one of the challenges that we have been seeing during the pandemic is the infodemic. And to be quite honest, the terminology of infodemic came during this pandemic with the amount of information that people were receiving, but also the misinformation and disinformation, etc. One of the things that we have been working with countries on is to make sure that there is a system for the social listening and community feedback, which means that the system of social listening will be able, it's kind of different softwares that are in place. Some of them are free of charge, other applications or softwares, they go with a little bit of a payment. But the whole idea is that you do a scanning of the different media outlets, whether regular media or social media. And by analyzing the content of these media outlets, you will be able to understand what kind of concerns, questions that is going on within the community. Now, the most important piece of that is not only the listening, it's the analysis it's understanding the concerns, but also what's exactly that we need to do in order to respond. And the response to that usually is very important because it does inform the different measures. So it's not only about the messaging, it's really the broader response to the different concerns that might be coming out. So we as WHO, we have developed a software or application that's called EARS, and really has been helping us to collect a lot of information from the social media, regular media. We've been using it in 5 countries, but also we've been training almost all countries on the different applications, but the system, and most importantly, how to analyze the information and how to come out with the right recommendations or advices. Now, this has been going on during the pandemic, and it's still ongoing. And what we're trying to do at the moment is to make sure that we have this kind of system exist in countries, which means that, I mean, if it's not only about the pandemic, the whole idea is really to prevent emergencies, any type of emergency. And therefore, having the social listening and community feedback as part of the bigger risk communication, community engagement system is very important. At the moment, we're trying to make a little bit of adjustment to the information that we're collecting. At a certain point of time, we're focusing on cholera, we're focusing on monkeypox, and we were really able to identify a number of sentiments or concerns that had helped us to put the direct messages, but also to advise countries on the right measures that they need to take. Like, for example, if we go back to the vaccine, generating demands for the vaccine, because we understood at a certain point of time that there are certain fear, people are not happy, the risk perception was pretty much going low. So it really helped us that one of the directions that we wanted to do is to continue with it, with generating the demand for the vaccine and move on with increasing the uptake, which to great extent helped in increasing the uptake in some countries.
I'm sorry about that. Thank you for bearing with me. Thank you for that, Dr. Samori. Annie, this question's for you. How best can we prepare our primary healthcare centers, so local healthcare centers, for epidemics in terms of human resources, drugs, and equipment? How can we ensure that these local health centers have what they need to fight, health emergencies, outbreaks, epidemics?
Yeah, again, first of all, it's being put the public health emergency as the priority, because when we're talking about decentralization, we're talking about localization, the primary healthcare will be under the local government authority. So in ensuring the local authority will put the public health emergency, epidemic and pandemic preparedness and also response mechanism being there prioritized. So it will impact to this the support for the primary healthcare, health post, or another public health authorities to put the modalities, the staff, and also the budget sustainability to support this the kind of initiative. Because we learn also from the implementation program in Indonesia, because the community-based surveillance can only work effectively when the community volunteer get feedback the public health authority, which is primary healthcare, about the confirmation of the cases, to be able to provide the first responder early response to the community. But again, sometimes the epidemiologist team, the medical team at the primary healthcare, there is no specific team that will manage all this surveillance system. That will be another challenge that we face in this program of the implementation. So we learn from our experience as well that this thing become the priorities of the public health emergency, and advocate to the local government authority to ensure the support to manage all this resource mobilization, financial sustainability. That will be one of the lessons that we got from our program implementation. Because again, the government have their limited health literacy as well. Because somehow, if you're talking about the disaster emergency, they put it like natural hazard emergency response as the main priority, because it's very visible. But again, if you're talking about minimum package standard of the public health emergency at the subnational level is being still challenging. So as we learn from our experience, this advocating this public health emergency, epidemic and pandemic preparedness as the priority, it will invite the support, the financial sustainability, resource mobilization, and it will also supporting the primary healthcare or provincial health office, district health office to provide their services in terms of the prevention and control for any kind of epidemic and pandemic. So that will be our lesson learned from the program implementation of the community epidemic and pandemic preparedness.
Thank you for that. Let's turn to the next question now. Marcio, this one's for you. What do you think is the most likely unknown epidemic that the world should be preparing for? Do you consider climate change as a meta epidemic? What are you in your country preparing for next?
Próxima epidemia. O que você está se preparando, né? Você no seu país, o que vocês estão se preparando para lidar com a próxima epidemia?
Pergunta difícil, né? Mas vamos lá.
Difficult question, but
Acho que
okay.
trazer a
I
questão do
think
clima
that, I mean, the issue of climate change is very important. In the city of Rio,
vários órgãos da prefeitura
many municipal bodies, they are discussing this already.
está sentindo já
We
alguns efeitos
are feeling some of the effects of climate change. For instance,
na cidade do Rio de Janeiro,
in Rio, it's ever more often
alterações repentinas
that we have sudden
no tempo, né?
weather changes,
Com chuvas fortes.
very strong rain. For example, one of the biggest recurring problems in Rio is the big, strong rains. I mean, we face storms. Usually in the summertime, we are starting our preparation for the 2023 summer. So we are surprised with storm, tropical rain. That brings a lot of problems for the operations of the city, but it is also an important risk for public health because the city has regions in the mountains, and every now and again we have populations that live up in the mountains. So it's necessary for us to work with these communities, do prevention work. We have monitoring for rain. And when the sort of rain meters, when they actually reach a certain level, population needs to move to sort of safer areas. Another concern that we've got in relation to climate change is the big heat waves that we get, What do you do when the temperature goes up too much? What are we going to do with the elderly? Because a lot of the times these people live on their own, at home. So these elderly people, they end up suffering more, when there is such as increase in heat as it was. So there is a discussion going on in Rio about climate change, about heat waves, about storms. And at the same time, just in conclusion, there is a lot of concern in Brazil and Rio related to the sort of re-emergence of diseases. Fortunately, we have low vaccination coverage that places us a sort of frail situation with diseases that can actually be, prevented, such as measles, for example, and polio, mellitus. So this is, some of the concerns really that we need to focus on for the near future.
Thank you. Amanda has joined our conversation in the panel. Amanda, did you want to hop in on this question?
Também falar alguma coisa?
Amanda, I think you have to unmute your microphone. We can't hear you.
Amanda, eu acho que você.
No.
Okay, cannot hear from Amanda. Can we hop to the next question? Okay, next question. How can we get the low and middle income countries to start documenting their public health experience and investing in emergency preparedness plans? Dr. Samori, this one over to you.
Documenting the experience of the different countries. And it's true that usually most of the disease outbreaks, if you want, or the humanitarian related situations, usually they do exist in the low and middle income countries. But at the same time, we know that there are a lot of great capacities and great workforce who can be part of the documentation process. Well, it's a culture, and usually this culture does not exist. But at the same time, the writing skills might be an issue, and that would be part of the support that the different organizations can help in doing this. And I take the example of Resolve and coming out with this great book. It's part of documenting what's going on and part of documenting the best practices. And again, if we talk about WHO, we've been working with so many different number of countries, of course, if not all of them, but we were able to document a lot of great examples. And those documentation, again, there are so many different ways for displaying them. Whether online, but also the country-to-country support or country-to-country sharing experience, also we've been able to facilitate this. Now, if we would like to look into the bigger perspective of investing in the preparedness and response, maybe I'm not really sure if all the audience they're aware of the international health regulations and the different tools that exist in place for the monitoring and evaluation, and how we were able to use them to support countries to develop national action plans for health security. And those plans for health security, they're considered as the overarching plans in countries because they do include all the reports that are generated from the different reviews. And they do cover a lot of areas, mainly the public health functions that are documented or are pretty much known under the international health regulations, but at the same time, trying to make the linkage between those public health functions within the bigger health system strengthening. And having these plans in place, making sure that those plans are identifying who is the responsible authority or sector for the implementation, making sure that they are costed, but also the financial part is clear, whether this is going to be secured domestically or there are needed some external efforts to do the external mobilization. And if we guarantee that those plans are continuously updated and having the means for implementing them, I think this really will help us to move forward because they do cover so many different areas. But with the recent lessons that we've learned from the pandemic, and particularly the areas that we have not thinking of them properly, if you want, or sufficiently when we look into the preparedness and response. And again, particularly the governance, the leadership, the finance, the community engagement, the infodemic management, these all have to be included in these plans for health security. And WHO is trying to take big part of the support to countries, of course, with the support of a lot of partners. Resolve is one of them. So if we manage to have those plans updated, taking into consideration all the lessons that we've learned from countries, but also making sure that we have the means for the implementation. And I think this really will help us to move a little bit with enhancing preparedness in countries. And just to respond to your point, when we talk about preparedness, I think we need to be prepared for the known and the unknown. But the point is, when you have a system in place that includes all the different elements, it will really allow you to be able to respond no matter what kind of emergency you're facing, because you have all the elements that are needed, the multi-sectoral coordination, you have the right manpower, you have the early warning system, you have the emergency operations center that will allow you to bring all the sectors on board and do the multi-sectoral coordination. You have the right medical countermeasures, but if you don't have them, you have arrangements to be able to bring them. You have the right diagnostics, and if not, again, arrangements to bring them, access to medical services. And therefore, you will be able to respond to any type of emergency. And if not, at least you have arrangements in place where you can bring the support from others, WHO and other partners as needed. Over to you.
Thank you. This is our last question for the day, and it's for Annie. What key strategies can be used to build sustainable water sorry, I can't read this, to build sustainable water and hygiene behavior change in vulnerable communities. What can we do to build on that kind of sustainable behavior to prepare for the future?
Okay, talking about the sustainability at the community level, it has to align with the culture, the custom of the community itself. So creating demand at the community about the behavior change, that will be the first things. And then the second thing is how you really get trust, community acceptance for your initiative in terms of the behavior change, and also get the how to ensure the community engagement are in place to be implemented. Because if you're talking about the engagement, you have to pass this participation first of the community. You have to increase their first how to really ensure the legal aspect or to ensuring this behavior change can be applied at the community itself. So we learn from our program, we build up this community structure for epidemic and pandemic preparedness, and we doing the local advocacy to the head of the village, and then the head of the village will form the a long process day by day, so it has to be in place. The structure of the community resilience has to be in place to support the behavior change of communication itself. So there is two things. The first is about the creating demand of the community, ensuring the community are aware about their needs for the health promotion, health awareness, and also to propose this behavior change. And the second is legal aspect at the lowest level, which is the head of the village, head of the community that can support the behavior change as the predisposing factors as well for the community resilience. I think there's those two things that we learn from our program implementation for community epidemic and pandemic preparedness.
Okay, thank you for that. I'd like to pose one last question to the panel. I'd like if everyone could keep their answers very brief, I'd appreciate that. Well, I think it's important to focus on all the success stories that we've heard today. I think it's also important to focus on what we still need to do. And I'd like to take the conversation from the hyper-local conversation to the worldwide conversation. Can each of you point to one or two of some of the most important things that we need to do to better prepare in a post-COVID world for all kinds of health emergencies, whether it be smaller outbreaks, epidemics, or pandemics? Dr. Samori, let's start with you.
Well, I think there are already ongoing a number of processes out there that they are basically have been put in place to address the many challenges that we have faced. One of them is the financing group. The other one is the group that has been put in place to start developing the new treaty, which should address the different areas of work that came clear during the pandemic, but were not addressed in the HR. But also another global process, which is the targeted amendment of the international health regulations, in a way that we understand that there are specific articles where member states, they would like to do a little bit of a change on them in order to be able to facilitate the preparedness and response that would be going on. At the same time, of course, the workforce, this is another area. But just to highlight that within WHO, the DG came out with the new global architecture for health emergency preparedness, response and resilience, and it does cover three main pillars. Governance is one of them, a system is one of them, and resources is one of them. And within the governance and the systems and resources, there are different projects that have been identified in order to be able to move forward with their implementation, but they're clear in terms of the shape of these areas of work. For example, when we talk about the systems, we look into the surveillance, we look into the rapid response teams, we look into the diagnostics, the medical countermeasures, and when we talk about resources, the global financing system. And at the moment, there is a new mechanism that has also been put in place that's called the Financial Intermediary Fund that would start supporting the implementation of the National Action Plans for Health Security, but also a big project to improve the workforce. What I'm trying to say here is that there are a lot of things have already started in a way that we have started to build on the momentum and not to stay a little bit because we want to make sure that the energy is still there so we can move forward with the implementation. I know I took much long, but just to highlight that there is already something that we have started with, and we do hope that the global architecture does provide the architecture for the emergency management as a whole with defined elements and projects to move forward. Thank you.
Thank you, Dr. Samori. Annie, let's move this question to you.
So 3 things that can be we can propose for the prioritization on how we can ensure this epidemic and pandemic preparedness. First is about the legal aspect. I'm talking about I already mentioned about this, the creating this for the government itself, because without the legal aspect, there will be nothing. We learn from Indonesia. All you have about interoperability data for surveillance, but we have to really ensure what will be the minimum indicators, minimum package of the epidemic and pandemic as a public health emergency initiative at the country level. It will be at the global level. We learn from global health security indicators. There is no specific indicator related to community preparedness. This will be our challenge on the implementing of the program itself. So when we're talking about community preparedness, what will be the specific minimum indicators that we can say that, okay, after our program implementation, the community already get better prepared. So what will be the indicator? So again, minimum package, solid indicator would be the second priority. The third as the priority support to really ensure this initiative can be replicated, can be scaled up for national-wide implementation at the country level. Because again, population is very big and very variety of the with the culture and so forth. So we really need to gain collaboration from broader partners, government agency, philanthropy organization to really ensure epidemic and pandemic preparedness initiative could be in place as our priority. I think those 3 things that we can address for now. Thank you.
Great. Thank you so much for that. I really appreciate it. Marcio, let's turn this question over to you. What's the one thing we can do to prepare?
Então, acho que
Yeah, well,
vou repetir pouco o que as duas colegas falaram.
Repeat a little bit of what our 2 colleagues have talked about. We need to have greater concern with public health emergencies. I think that people sometimes think that emergencies will never happen. And they have no set time or date to happen. So we need to have more funding. We need to have a legal framework, set of laws that may provide us with legal sustainability to face such situations. In practical terms, we need to invest in 3 things, okay? In preparedness, and once more, I point out the importance of the plans and drills. We haven't talked about drills, but it's important for us to test the plans, so we need to drill them out, monitoring, including early detection. So we need to monitor constantly the epidemiological situation of all diseases and have an early detection system for the diseases that we do not know yet. And then finally, the response. This response needs to be coordinated. This response needs to be integrated. And we need to have a governance environment for this response. and also ensure communication without forgetting the population's participation. Community engagement is going to influence directly in the quality of the response. And finally, I'd like to say that we need to make the decision based on scientific evidence available and on epidemiological data here in Rio. We always say, right, information for action. And this is how we understand that an emergency should be faced.
Thank you all for such an important conversation today. Thanks to the audience for your questions. And thank you again to our panelists. That's all the time we have for today. Now let me turn the program back to Amanda McClelland. Amanda.
Thank you so much, and thank you to all the panelists for such a rich discussion. I think, as we've heard, there are a number of challenges we still face, but there's a need for optimism and a focus on progress and implementation. Success can happen when we prioritize building strong public health systems committed to consistent preparation and prompt, decisive action. Preparedness works. Our Epidemics It Didn't Happen report shows that effective emergency response are not out of reach, and that the hard work and dedication of public health workers can and does pay off in disruption of epidemics and saving lives. If we continue to learn from our success as well as our failures, there will be more epidemics that didn't happen. If COVID-19's taught the world anything, it's that diseases can travel fast. We must be faster. Thank you all for everything that you do in saving lives, and thank you again for attending today's session.